Psychoanalysis technique, concepts and issues, session 5. This is the last session in a 5-session series dealing with concepts and issues falling in the area of technique in psychoanalysis. Let us look at 10 more concepts and issues in this last session of the series. First is what stance we take in the session. It can be a supportive stance like a cohesion, where the primary task we do by commission and omission, and more often by omission than by commission, is the task of supporting and holding the patient. Patients who are extremely fragile, not ready for interpretations, they need support and holding for a long time till they can develop the ego strength and be ready for the classical interpretative therapy. Once they are ready, we take the interpretative stance. Our stance changes with fragility. Our stance changes with progress of therapy. Our stance changes with the development of ego strength. Our stance also changes with the resolution of fundamental problems, especially the split. The interpretative stance is the classical stance that we take in psychoanalysis, except for in the cohesion and the Jungian approach, also not in ISTDP. So Jungian approach, cohesion approach and ISTDP, these three are separate. But apart from this, in most other schools of psychoanalysis, the stance that we take classically is the interpretative stance, where we give interpretations to the person. And it's very important while we take this stance that we calibrate the intensity of interpretations. Two important aspects here are, first, don't give interpretation too soon, too deep. Always go from the leaf to the branch to the trunk to the root. Never go directly to the roots. If the therapist does not have a strong theoretical ability and is not able to do pathogenesis to its roots, this question will not arise. But for therapists who are theoretically strong, who are able to do pathogenesis very well and decipher the root of the problem in conceptual terms very clearly, for them, this calibration is very important. If you directly start giving interpretations addressing the root, it becomes so difficult, so unbearable, that often patients stop coming to therapy. There is an old saying, brilliant interpretation and the therapy ended. So that is something we have to avoid, that we calibrate the interpretations not too deep, not too soon. And second, we give interpretations in a way that it is not too hurtful and bearable for the patient. A continuous calibration in terms of bearability is very important. Otherwise, very soon, you start taking the place of a hurting parent, and it's only the healthy part of the unconscious healthy part of the patient, and his compliance makes him undergo that masochistic process of therapy. So therapy need not be a masochistic process. Although some pain is inevitable to be borne by the patient, it did not essentially and continuously be a masochistic enterprise. So it's very necessary to calibrate the interpretations. we also remember that interpretation is not the only intervention that we can make. Often we overestimate the significance of interpretation and we start looking at interpretation as a synonym of intervention, which is not true. You can do non-interpretative interventions by silence, by omission, at times by commission, and one of the very important non-interpretative functions in therapy is to create safety and provide containment to the client. This too enables the client to internalize a good, reliable, stable object, and that is something which is a not very important non-interpretative task of therapy. Second is the challenging stance. Those who are healthy enough not only to take interpretation but to take strong type of challenging interpretations, you can use challenge, but be very careful while using challenge and confrontation. So challenge can be in the form of mirroring. When the person says, I don't know why I am here, and you say, we make a note of it, can we just clarify it before we go forward? Because you don't have to be here. Or you can take more of confrontational stance and you say, every time we try to explore X, you come up with a defense or a diversion, and it has come to a point where we are going nowhere, so you will have to take a call if this is helping you and you wish to go forward, which would be what is called a head-on collision. So we have this range of stances from a Kohutian holding stance, where the prime element is containing, supporting, empathy, allowing for self-object experiences, to the second extreme of head-on collision, from holding to head-on collision. In between are all the options of interpretative stance, challenging stance, confrontational stance, and then of course at the end head-on collision. So obviously we use head-on collision very rarely. Some people never use it, which is not a problem at all. I personally don't use it because I find it too risky to use head-on collision. It gives results a few times, but in most cases it just gives very negative results. So unless you are very sure that for this particular client at this particular point, head-on collision or confrontational stance will work, don't use confrontational stance or head-on collision, because it depletes very heavily the balance of positive transference that is there. Because this positive transference, the unconscious therapeutic alliance, is like a bank balance. And these issues, they draw upon the bank balance and deplete the bank balance. So from a holding stance to a head-on collision stance, in between are various stances of interpretative stance, challenging stance, confrontational stance, and then at the end, head-on collision. In certain methods like ISTDP, challenging stance, confrontational stance, head-on collision is very popular, very not pervasively, very frequently used, I should say. Whereas interpretative stance is not used so much in ISTDP. Whereas in classical psychoanalytic psychotherapy, interpretative stance is the most used stance. Rarely challenging stance is used, and confrontational stance and head-on collision is almost never used. In Kohutian form of technique, even interpretative stance is used very sparsely. The holding stance is most commonly used. And challenging, confrontational or head-on collision is rarely used in Kohutian therapy. I don't think most Kohutians ever use confrontation or head-on collision. It may happen at the spur of the moment, but never by design. 45th point is containing. Now, this is a very important point. What does it mean to contain? Best example of containing is a baby crying and beating the mother with his hands. and the mother not responding to rage with rage, anxiety with anxiety, but gives back the child a smile. So the input is anxiety and aggression, output is the smile for the mother. And mother is that processing system which is able to take in difficult affects, contain it, process it, convert it into positive affect and give it back to the child. This often is the function of the therapist. That by projective identification and by other means, the patients put difficult emotions in us or give it to us to resolve. And we have to be like a processing system where the input is negative effect, inside is the processing, converting the negative effect into positive effect, holding the negative effect and giving it back to the patient. So this containing is not only like a storage that you contain what comes up and not get disturbed by it. That is the first function, that you accept what comes in and you are able to manage it. You are not overwhelmed by it and you don't act out of it. So this is the first level of containing. The second level of containing is to convert this into something positive and constructive and give it back to the person. The second level of containing. Third subtle level of containing happens, which is very esoteric, and that is where you almost feel as though some affective movement is happening from the client towards you, almost like going into your aura and turning back and going back to the client. A complete entry into you, getting processed and going back to the client in an unconscious, very subtle esoteric way. It's very difficult to describe it, even more difficult to prove it, but this is often a experience of especially those who practice Bayesian technique and use containing as one of the core tools of technique. Scoring off, we have to be very careful. The patient will score points of you, and we have to be careful that we don't respond in the same way. We don't start scoring points of the patient. Otherwise, the containing goes off and we are seen as one more person who attacks, who persecutes, who scores points off. So we are there to heal, not to score points. And often we have to allow the patient to score points because he has not been able to score points anywhere else. Or rarely he has been able to do it and he wants to do it here. Winnicott also talks about the child baby's right to exploit the mother. And that unfulfilled desire can be working out in therapy. Very important to know when the person is ready for interpretation. And there we have to start with very mild interpretation and see how far we can go with interpretations, how intense interventions can work. So it is a function of ego strength. It is a function of healing of the split. It is a function of development of ego strength and internalization of a good, reliable, stable object. It is a function of development of a healthy self. And we have to test out before we really go for hard, deep interpretations. Especially if we are making a transition from supportive or holding stance towards interpretative stance, we have to be even more careful. If we are dealing with fragile patients, similarly, we have to be extremely careful and try out a soft interpretation and see what happens. In ISTDP, there are ways of looking at the way anxiety develops in the person. What is the response of the person to an interpretation or an intervention, and whether the person remains in the healthy zone or goes in the unhealthy zone, and then we calibrate. Similarly, in classical psychoanalytic psychotherapy also, we may ask for certain clues about anxiety, or we may see the body language of the person, the breathing pattern of the person, or we may see the way the person starts speaking or acting in the session after the interpretation was made. That gives us an idea whether to continue or not continue. If it cannot be decided on the spur of the moment, then it can be discussed in a supervision session, and then you can take a call on how intense interpretations can be made at this given moment. Respect the person who has pathology, and also respect his choices to continue with pathology if he wants to, even as we point out the cost of it. Often people suffer from always being criticized about some imperfection they have, and this creates such a rage in them that in order to get even and get revenge and hurt or get across to the other, they unconsciously decide not to get well. Once we accept unconditionally and respect the person, including his pathology, it brings about a fundamental change in the person. For the first time, he feels free. He does not have to react to anybody. He is free from everyone. And being free from everyone, he enters into a state where for the first time he reflects deeply and completely based on his own wish and will what he should do. And in more cases than not, the person comes out with a healthy decision. Of course, this does not apply to those with psychopathology, the psychopathy or sociopathy, where interpretations have to be made. We can have an affect focus or a cognitive focus or a behavioral focus. In psychoanalytic psychotherapy, essentially we have an affect focus. So analysis and making unconscious idea conscious may be a route to get to affect, but we should always remember that only 15 to 25% relief will come from analysis and understanding. 75% of the real relief and the fundamental restructuring will happen only by catharsis. And that particular catharsis which is followed by restructuring. Because there can be a minor catharsis which is not a fundamental catharsis which brings about a fundamental restructuring of the unconscious. So we have to maintain affect focus. We have to be clear that we will see multiple catharsis, and we will go to the roots where at some point the catharsis will be so fundamental that a complete restructuring in cognitive and affective sense will happen in the depth of the unconscious. And therefore, we have to maintain affect focus and not get lost in thoughts. Theory focus is very important. Not only one school theory, but multiple school theory focus. Otherwise, it becomes just two people talking and you did not be a therapist. So if theory is absent from the therapy room, the therapist is also absent from the therapy room. It is then two individuals talking, but there is neither of them is a therapist. So theory focus is very important. Theory has to inform the conversation, and the more theories we know, and the more we can synthesize them or use them in turn, better is the flow of therapy, quicker and deeper, and more are the chances of healing. So a consolidated knowledge and strength of theory is essential for good psychoanalysis. With this, we come to the end of the series of 5 sessions focused on concepts and issues in technique in psychoanalysis. Obviously, there is more to technique. It can be covered up in subsequent sessions. If you have any questions or doubts, you can write to me at hvindia@gmail.com. Thank you for seeing the series.